I was non-functioning. Self-care was out the window.
Mm-hmm.
Being clinically depressed, I found I wouldn't shower for days. Didn't socialize. Never left the condo. Was had zero motivation. I absolutely believe TMS saved my life. I absolutely would recommend anybody who's struggling with depression, with anxiety, even with post-traumatic stresses or anything that's affecting their mental health, their well-being. I would absolutely recommend it to anybody.
Hi, guys. This is Marco from Our Hope Treatment. Today we have a special guest, Ann. She's the one who tried TMS, and TMS actually changed her life. We are here to hear her story, and I hope you will enjoy and like it and learn from her. Hi, Annie.
Hello.
Hi. Can you tell us first, how did you find out about TMS?
Well, actually, I learned about TMS scrolling through Facebook, and some Facebook reels started popping up on TMS, and I'd never heard about TMS before. Watching these reels, it seemed to me to be similar to like old school ECT, but I was really intrigued at what I was, you know, listening and learning about as far as TMS. I did a little Google internet search on it and um, really was intrigued. So I called one of the providers of this particular reel. I called one of the providers and inquired about TMS and how I might go about, getting TMS treatment. Uh, when I spoke with that provider, they seemed to be more concerned with the mechanics and the business aspect of it, uh, rather than what was going on with me at the time and why I needed and why I felt like I needed the treatment. So I proceeded to look into other providers in the area and reached out, contacted another provider, and I had a similar experience
Mm-hmm.
where they were more concerned with the business aspect of it, the business side.
And when you
And
think about the business side, is it about insurance?
yes,
Okay.
really, they didn't ask like, what's going on with you? What are you experiencing right now that you feel
Oh,
like you need the treatment?
okay.
They really didn't ask any questions like that. It was just very mechanical. And then, so I continued to go down the list and look at other providers, and I came across Our Hope. And what distinguished Our Hope from the other providers was I found that Our Hope really was concerned, what's going on with you? What are you experiencing right now? What are your symptoms? What are you looking to do? What do you need the most help with? What are you struggling with? And how can we help you? And that really, stood out to me.
Well, there's a reason for that, right? First of all, in order to help someone, you need to listen what kind of problems and challenges they have. And can you briefly tell me about your history and what kind of challenges you had over the past, I don't know, let's say 10, 20 years?
Well, I have complex post-traumatic stress disorder. That's compounded also by I'm a multiple event adult PTSD survivor. However, it's really the events in recent history, in the recent like 12 months, where that led me to really needing or looking into TMS and needing some treatment. I experienced the loss of several loved ones,
Mm-hmm.
deaths of several loved ones, several other traumatic experiences, all within a 12-month period. The loss of, or not the loss of, but the end of an employment. And I found myself, unexpectedly unemployed in an employer's market. Uh, and that extended for, 11 months. And so that really threw me off. All those things combined really became overwhelming. I became, uh, I spiraled out, just completely spiraled, became clinically depressed, extremely anxious. I was in a state of paralysis. I lost faith in myself. I lost interest in all activities, socializing, everything,
Mm-hmm.
and just really became non-functional. Non-functional. I was in talk therapy. I was in therapy 3 times a week. I sought pastoral counseling, EMDR, and even antidepressants, and nothing was giving me any relief. I believe that one of my doctors explained to me that all of these events combined really blew my nervous system, which really was difficult to get back to square basically on my own just through talk therapy. So that's why TMS became extremely interesting to me, because I felt like that might reignite these neural pathways and help me experience and overcome these feelings of anxiety and the feelings of despair and hopelessness, and really the fear of not being employed, and really it just was overwhelming.
Okay, I understand. I see, first of all, that you had so many stressors in your life which caused you to experience all of these conditions and the symptoms. And I see how they reflected on your life. And also what I would like to everybody to know that I was there when you came first time and asking for TMS. And I really recognized the need for the therapy. That was a crucial point. You were really one of the special patients which asked for help, and I recognize that if we offer you help, that you will really commit to it, that you will not miss any appointments, that you will follow other follow-ups, treatment suggestions, and you really did that. Also, what I saw in you at that time, so I'm talking about maybe 5 months, something like that, you were very, I would say, hard to communicate and have a sense of it. Okay, it was really disoriented, and that was, for me, that was a red flag. So that's why we pushed so hard for you to get a treatment even before the approval, just to help you and to put you in a better position. Luckily for everybody, you are one of the best responders I have ever seen. So within the first 5 treatments, I believe, like maybe even 2, 3, you can correct me if I'm wrong, I saw a different Annie. You were reporting some benefits like better sleep, better energy, but day by day, what was happening is it was so nicer being in your company. It was so nicer having you there and talk to you. You are such a funny person. You are such an interesting person. And then seeing you getting out, finding a job, finding a great, great job, which promises a great future to you and your family. It was just something which is amazing. Also, when you came to our clinic, and I remember you were doing EEGs and other tests, you were at the max. It almost everything. And when I say the max, like PHQ and Hamilton D, all the tests actually
I
showed
was off the chart.
off the chart.
That,
Yes.
that's probably consistent. Yes.
Correct.
I
But the thing is, the way you responded to TMS therapy was remarkable. Okay, it was like meant to be for you, exactly how you were describing every day. Hey, I need this. I feel great when I have this. Okay, and day by day, we were looking at your tests. We were going over with you, and the results actually followed what you are reporting. Right. So, if you can add a little bit more, like from that time, like 5 months ago, how your symptoms affected your life. You mentioned it was very hard to find a job because you couldn't focus, right? What about socialization? What about the energy levels?
I really was non-functioning. I was non-functioning. Self-care was out the window. Being clinically depressed, I found, I wouldn't shower for days. Didn't socialize, never left the condo, had zero motivation, couldn't bring myself to even get out of bed, clean, do anything like that. Nothing brought me joy. I didn't even understand the concept of joy anymore. And I just think my whole nervous system was just shot. I was surviving, but I was not thriving. And I knew I was in serious, serious trouble. I considered hospitalization, which I really, it was out of the question given the fact that, I was unemployed. So I was really desperate. And it was a very, very scary time, a very, very dark time for me. to be non-functional and really being desirous of wanting to work, willing and being in this wacky, at the time, it was an employer's market, so I was up against 500 other applicants for anything, and then how am I going to interview and present well in an interview when I'm feeling internally like I don't believe in myself, I don't have any confidence, I don't have any, I just have no confidence in myself. Even
What about the physical look? How you can compare self? I can compare you, but what would you say like 5 months ago and right now? How all of this affected your physical appearance?
I was a fractured person. I mean, that's the easiest way to say. I was just completely fractured and broken, and it was visible. It was just, completely visible. And like you said, when I began getting the treatments, I felt the difference within the second day.
Yeah.
Within the second
Amazing.
day, and then it became like, I gotta go. I need to get there. I've got to have this. I need to get the tippity tap. So the tippity tap was everything I could think about, and by the fifth session, I almost felt like an imposter. Like, how is this possible? Like, everything began to change. I suddenly, my sleep improved. I didn't feel like my anxiety decreased over, gradually it decreased. I began to become more motivated.
Okay.
Started beginning to get back into the swing of self-care and taking care of myself and realizing the importance of it. But it was a gradual, but still at the same time, I noticed immediately something was changing inside of me. And it took not just the TMS, but also my own recognition of what I need to focus on and, relying on my internal abilities. And I think Our Hope also helped me redirect my thoughts, kept pointing me into a positive focus. And truly, I believe TMS saved my life.
Amazing, amazing. And I remember, like at the beginning, we were talking mostly about, I would say, dark topics. Okay, so you were in a dark place, and topics were very sensitive, very dark is the best expression. And you remember, like a month ago, something like that, you had your, I would say, last session at that TMS round. And we were talking about vacations, going to the beach, reading a books, what you can do with your husband, like to improve the quality of your life, right? So you see the difference there, how, and that's why I told you I enjoyed the course of your improvement, because you as a friend, as someone who I spent, let's say, 30 minutes a day, I started enjoying being with you because I learned from you. I learned a lot. Now today you have a six-figure job, you are investor, you are in the stock market, you are in so many things. This is just remarkable. Testimonial, first podcast testimonial for us.
Well, I'm honored. Thank you. I'm honored to I'm honored to have Our Hope be, Team Our Hope for life. That's the way I see it.
Yeah,
For life.
you will stay our friend for forever. Let's talk a little bit about the therapy itself. I'm sure that prospects and the future people who are interested in TMS therapy, they usually have questions. Okay, what is that? You're going to do something with my brain. What are the side effects? And whatever I say as a TMS specialist, and it's just not enough. They want to hear it from someone who, from perspective, like patient's perspective. So let's start from beginning, like how it looks like from your perspective.
Well, in terms of, I enjoyed the treatments. I know that they will say that sometimes people are a little sensitive to the treatment, but I didn't. Me, I always wanted to turn the dial up. The stronger the better, but that may not be necessarily the most appropriate thing. So,
Yes.
But I didn't experience any side effects whatsoever. I mean, you can feel a little, sometimes a little painful sensation, in the lobes that you're treating, but I didn't experience any side effects. Unless you want to consider sleeping better a side effect, feeling better a side effect, feeling joy, for the first time in a long time a side effect. That would be the side effects.
Well, usually what I hear from other patients from other clinics, and I really don't know how they do their stuff, and but I hear, oh my God, I have a terrible headache. Actually, there's one good side effect, and that is fatigue. Fatigue is basically a symptom, which means that your brain worked out, and when brain works out, that means something is happening, something new is coming, okay? And I'm talking about very light fatigue. Someone even doesn't recognize that. In your case, I know that you didn't have any like a headache, right? You
No
didn't, which is
headaches.
kind of the most common. But overall, can you describe the feeling of, you're calling it tippity tap, right?
My tippity
Yeah,
tap.
tippity tap. Okay, on your head, and sitting in a chair. Is it relaxing? Is it intense? Is it like how you feel after the treatment? Can you drive? Can you go home, be a wife, work your job, whatever?
I think you'd have to ask my husband if I can be a wife. He would probably be the better person to ask on that. But I let me think. Let me go back to what you originally. The setting, the clinic setting is very comfortable, and our hope makes you feel very comfortable. You have a warm blanket, everything like that. I didn't experience any headaches at all.
Okay.
I didn't experience fatigue. I know there was one session where you did say, okay, we're gonna do this on this lobe, and we're gonna. I can't remember if you said we're gonna switch to delta or theta waves, but you wanted to kind of practice on my sleep that night, and you said, tell me how your sleep is this next night. And believe it or not, I slept through the night perfectly. So whatever you did was perfect. I was able to drive, so I didn't experience, I can see where some people may have some sensitivity, but I didn't have any sensitivity. And the tapping, the pulse, I call it tippity tap, but it's almost like if you can imagine throwing like 10 snap pops on the ground.
Okay.
And that's what it feels like. It doesn't feel that that's the sound,
Okay.
but you do feel it, but it's not overwhelming, and you're not in agony.
Did you at some point felt like, okay, I have a TMS visit right now for, it's going to be like 30 minutes, right? 25 minutes, something like that. Have you ever felt like, oh my God, this is the time for me. I'm going to be relaxed. And then after that, I'm going to be even stronger and get back to work and get back to other duties.
I was very optimistic. Every time I came, I was excited. I became it. At first it was like, okay, here's my medical appointment. I'm going to go do this. But like once I started, I just started. It started clicking, and it became an exciting thing to do. I got to go. I'm going to go and get this done and get my tippity tap. And I felt better. I felt energized. Actually, I felt energized afterwards.
Okay.
And yeah, no, it was
Okay.
it was an amazing experience. I absolutely believe TMS saved my life. I absolutely would recommend anybody who's struggling with depression, with anxiety, even with post-traumatic stresses or anything that's affecting their mental health, their well-being. I would absolutely recommend it to anybody, and I've shared it with a lot of people who are interested in it.
Thank you for that. Thank you for that. And I skipped to say that here in our Hope treatment, what we do is we collect two type of data. So it's subjective and objective. We do tests, which you do every week, right? Where basically you are reporting how you feel. But also we do have EEG, and we track your progress over the weeks. And the numbers, we went over those numbers, but you were dropping like every week for at least 10 points.
Really?
Yes. So every week, 10 points, and that was reflected even on EEG. So it's not just you have that feeling. No, your brain was in a more optimal level, and that's how you start feeling better. But I'm telling you, you are one of the kind. We did have a couple of successes like you, and hopefully they will also join us and share their experience. We did, and I wish that everybody's committed like you, because the commitment is the very big thing for TMS. And also following like a regime, please go to sleep. If you cannot sleep, give it a chance. Try it. Okay, vitamin D, more water, and other stuff, other suggestions. People will think that they're not that important. Well, they are.
No,
This is not medication therapy. Don't ever forget about that. This is not medication therapy. This is something natural. And from the type of the world where I'm coming from Europe, we usually when we get cold, we don't grab let's say Tylenol or stuff like that. No, we got like hot teas, we got like hot soups, we got natural things, and if that doesn't help, then we try medication. It seems that here in the United States, it's a different story, and I did learn that by running the clinic for the last couple of years. And as you know, insurance requirement is that you first must try medication and the trial of talk therapy, which, by the way, we suggest always stay. That's a very good thing. Talk therapy, find a very good talk therapist, connect with them, and it really helps. So for the end, I would like one more time, if you can talk with the future patients, with the prospects, why you think they should do this, why should they try, and just basically give them a heads up about the therapy.
Well, again, like I'll say, at least in my experience with, and as you just explained, I was really deep in the gutter, really, and I just absolutely shot out like a light. I believe, completely transformed my life. So I believe getting away from, you're right, the Western medicine is all about, let's give you a drug and let's just treat the symptom, not the underlying, and oftentimes those medications create the very problem that you're trying to treat.
I mean, they are necessary, of course. They are necessary in many cases. However, they don't cure, right? You
They
have
don't
to
cure,
leave
and they're
under
treating a
therapy.
symptom, and they're often, I believe that they sometimes dumb the neural pathways that I needed to get reignited from all the stressors that had affected me. And so I would, to anybody, I would encourage that they definitely give this a chance. It's non-invasive. It's not a prescription. It's not a drug, and it's 36 sessions that will transform your life, absolutely. And what can you lose? You have everything to gain.
Absolutely.
You have
What
everything to
what I
gain.
like to tell our patients is, okay, so let's see what is the best case and the worst case scenario. The best case scenario is, okay, you're depression free, you're symptom free, you don't take any more medications, right? And you start living your life at the fullest. That's the best case scenario. The worst case scenario is, okay, so you stay exactly where you are. You continue doing medication, doing whatever you do. TMS cannot and will not work for absolutely everybody, and insurance was paying for it, not exactly you. So you lost about 20-25 minutes a day. Was it a try? And there was always like, hey, yeah, you're right. I have nothing to lose. Let's try it. And then I would say the success of our clinic, we never had anybody saying, "Hey, I don't feel better." No, everybody say, "I feel better. I'm going to continue using medication. I'm going to continue enrolling into, let's say, physical activities and other stuff. But this did help me. Thank you so much." So that's the worst case scenario it can be. Thank you so much for coming here today,
Thank you.
for taking the time to be with us and to share your story. I understand how difficult for many people can be to share their story, especially because the topic is kind of sensitive. So I really appreciate that. And I hope to see you, let's say, in a year, maybe for a booster or something like that.
Oh, you
and
will.
and we will stay friends, definitely. I wanna follow your career. You're now a successful lady, and I wish you all the best.
Thank you so much. I want to thank Our Hope because I believe I've gone from surviving to thriving now. And it exceeded my expectations on all levels. So I thank the Our Hope team. I can't say enough about the Our Hope team, and I can't say enough about TMS. So thank you.
You're welcome. You're welcome. Thank you.